Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. Today we're here at Kaleidoscope Juice, but before we show you around, let's take a look at what's coming up on the show. We'll show you how juicing could help your overall health, including your heart. Information about a free community event to get your questions answered about heart disease. And we hear one story about the importance of knowing CPR and how it can change a life. All that and more in this episode of Your Health. We're here at Kaleidoscope Juice in Scottsdale, and joining me now is owner and founder Alexandra Ma to tell us more. Welcome, Alexandra.
Thank you so much.
First off, what is Kaleidoscope?
So Kaleidoscope is a collection of healthy juice and smoothie bars located in Arizona. We serve really great organic cold pressed juice, smoothies, acai bowls, avocado toast. We have our own gluten-free bakery. I actually started the company when I was attending Arizona State University. I saw that there was just a big missing for healthy, quick options. So I decided to put together a business plan, and I was the recipient of a grant program through ASU with mentorship, and that's really how we got started.
Awesome. Let's talk a little bit about cold press juice, because you hear that term a lot. First off, what does cold press mean, and what are the benefits of cold press juice?
So cold press juicing is a method of juicing. It actually uses big hydraulic plates that applies pressure, and it's a cold process, so we don't get that same oxidation that normal juicers do. So it's just a really great way to juice to maintain the quality of the juice and the nutrients.
Oh, okay, good to know. So February is Heart Health Month. What are the benefits of juicing related to heart health?
So I truly believe that food is medicine. So if you can incorporate really great ingredients, organic ingredients like leafy vegetables, beets, garlic, those have such a great power to heal.
Now, you all are very science-based in combining nutrients and ingredients here at Kaleidoscope. Why is that so important?
So my partner, Brooke, actually has her master's in human nutrition, and we have incorporated a lot of what she has learned into our juicing. So just going beyond the normal kale, celery, cucumber, and looking for other ingredients like turmeric, chlorella, spirulina, garlic, cayenne. Those are all such great things to add to your juice that you might not expect.
Now, Alexandra, what is the difference between juicing versus blending the whole fruit? What's the difference as far as health benefits?
So they're both fantastic. With smoothies, you actually retain all the fiber, which is really good for your gut bacteria. It keeps you full. It's super important to have fiber. But juicing, on the other hand, it does the work for your body, so you're able to easily absorb those bioavailable nutrients that are already ready for digestion. So again, juicing is fantastic, so is smoothies. They both have their time and their place.
Juicing at home, are there tips that you can give people?
Try and go organic if possible. So really, like if you're juicing, it's so bioavailable and there's not a lot of barrier. So you want to make sure you're using the highest quality ingredients. So just head over to the organic section.
Now, Alexandra, you all have 7 locations now. Congratulations
Thank
on
you.
that. The demand is there, right, for eating healthy?
Yeah, people are looking for healthy options. I'm so happy. It's really just becoming such a big category. We're so lucky to have such a great team and to have grown over the past year with 3 new locations. We're just about to open our 7th in Gilbert.
Now, Alexandra, I personally love juicing at home. So what are some ingredients that people can add to juicing at home for maximum health?
So create your base with something delicious and tasty like apple or beet, and then sneak in your leafies like kale, spinach, and collard greens. And if you have that nice sweet ingredient, it'll mask the flavor entirely, and you won't even know that you're getting all that healthy stuff that is so great for your heart.
Well, thanks so much for joining us, Alexandra, and sharing all this great information with us. If you'd like more information on Kaleidoscope Juice, just head over to their website. We all hear about the importance of knowing CPR, but for one couple, it meant the difference between life and death.
Please, I think my wife's having a heart attack. She passed out. Listen, is she breathing? No, she's not.
I met Tina at this college called Biola University. We physically, she was tall, she was athletic. So a friendship started, and then we got engaged. And then 6 months later, we got married. She made the things that I like to do, she made it better by being there. February 12th, 2018. A friend, Jeff, called and said, hey, I'm in the area. I'm gonna stop by and see you guys. I said, hey, we're gonna go hike real quick, but yeah, come by.
When I got here, Tina and I were standing shoulder to shoulder 1 second. The next second, Tina had fallen virtually straight face forward into the rocks.
Jeff yells at me, Brian, call 911.
When we got there, we found Brian Hines over Tina on the sidewalk, and Brian was performing CPR.
So the first thing that we did was we got out and assessed her, realized that she wasn't breathing. We ended up shocking her 5 times en route to the hospital.
They loaded her in the ambulance. She had not responded. She had not come back. I told God that if he'll give me Tina back, then he can take anything else. A doctor came in. It was crazy. He had that look on his face, like he was going to tell me bad news. He said those words I never thought I'd have to hear about my wife. He said, your wife is alive.
The next day, on February 13th, when I woke up, I was able to hear voices of my kids and Brian's voice, and I was able to express on my own. I wanted to make sure that they knew what I had seen and what I experienced.
My son, Jacob, goes, I think she wants to write something. And she starts writing, and you can just see it's just messy. You know, after like 20 minutes, we put together that heaven. It's real, and you nodded your head.
I experienced the bright yellow light and the experience of knowing that I was face to face in heaven with the Lord. And I'm waking up thinking, I have to tell you guys, this is real. It's real for me.
I would never thought before this that I could shock someone 5 times and they would come walking in the firehouse 2 weeks later. It's a true miracle.
Since February 12th, life is different now in that I view everything as being details of God that are orchestrated.
I got you back, and I thank God every day. I get to look at you and like, thank you, God.
The American Heart Association says being physically active is one of the most important things you can do to prevent heart disease and stroke. 30 minutes a day, 5 times a week is an easy goal to remember, so get up and get moving. Here's what's coming up next on the show. We'll tell you how to attend a one-of-a-kind event to learn about heart disease. And we take you to Eternal Spring of Gilbert to see how they engage their residents. An active and engaging lifestyle is at the top of the list for residents of Eternal Spring of Gilbert. Take a look.
Eternal Spring is a community that consists of assisted living and memory care. We are a boutique setting. We're nestled within a beautiful surrounding community, so when the residents move in, they feel like they're home. My name is Marcia Turner. I'm the executive director here at Eternal Spring of Gilbert. I think when you walk into Eternal Spring, yes, it looks like a beautiful hotel, but it was very specifically and specially designed with all the amenities that a resident needs.
We have been searching for over 2 years for assisted living and taking mom and dad to go look at places. We'd go into them, maybe they looked like too much of a country club. Then we'd go into another one and it was like, oh, I'm not gonna leave my mom and dad there, you know, and when we walked in here, we just felt this is just amazing. When we walked in this room, mom and dad both were like, this is okay, this is home. Mm-hmm. You know, it just felt right. It really did.
It's not a cookie cutter. 2 people come in together, they've been together 70 years, doesn't mean they need the same thing. And so that's what made us happy, because they were willing to work with everything that we requested we asked about. They have dietitians, they have activities people.
They have a
physical
massage,
therapy,
a massage room,
yes.
a full salon. So manis, petties, hair.
Did you mention the theater?
The home theater, yeah.
Oh,
And
they
the
have
family
swap-
kitchen.
And the family
kitchen.
I love that.
So when our kids come, when their grandkids and their great-grandkids, they can go in and make cookies with mom and dad.
Those kind of things make a difference.
Since mom and dad have been here, I can't tell you how incredible this staff has been. I'm sorry, it kind of makes me want to cry because they're so good.
So good,
So
so
good.
attentive, and they listen to what we need, not just, well, this is the way it's going to be.
Food's good. Everything about it that we've seen, we enjoy it.
I think what sets Eternal Spring apart from the competition is first, our team. We are very much like a family. We try to do what we would do for our loved ones.
Residents right now seem thrilled to be here. They've been pining away to get in, and so they're very excited to be here, and they're enjoying the food, they're enjoying all my team and all the caring staff, so I think everyone's pretty excited to be here. It can be different here at Eternal Spring. Let us show you how.
Heart disease is a leading cause of death in the U.S. In an effort to educate the community about heart health, we have an incredible opportunity for you to learn from the top doctors in their field.
Scottsdale Interventional Forum is our baby. You know, people look at this and say, "Gee, you know, you're doing a great job with it." To me and to our team who helped to put this on, it's like the Mona Lisa for us. It's a 4-day continuing medical education program where we partner with educators from around the country to demonstrate what is new, what is novel, the technologic advancements, the treatment advances for cardiovascular disease. And then of course the highlight for me is the community event where the lay public, non-medical people come to learn about what's new and what are their treatment choices and options if they have heart disease.
So it gives us an opportunity to really bring people up to speed as to what is happening right now and what may be available. And that's incredibly important because it's challenging to get into any physician and be able to have a chance to sit down and listen for a couple of hours. That just doesn't happen in our world. But having an opportunity to be in the audience with multiple physicians, giving some education over the course of several hours is really unique.
We do a live case. We try and think of what is new and novel and timely, and we actually do a live case for the lay public to demystify, if you will, what it is that takes place in the cardiac catheterization laboratory or in the operating room. Women in heart disease is an extremely important piece, and we would be remiss in our duty if we didn't have a piece on women in heart disease. One of our talks is going to be the power of prevention, how to prevent heart disease. The best way to treat cardiovascular disease is treat it before it occurs.
And that's lifestyle stuff. That is making sure that you keep yourself active, that you eat well, that you're watching your weight, that we're doing all of those things that we sort of intuitively know, but being attentive and doing that as a discipline. And that's really what we want to stress with prevention and lifestyle modification. And we do have discussion about that. That's always part of our panel discussion at the community event.
First and foremost, this is free to the public. We want to make certain that there are no barriers to education. I think that people who are touched by heart disease, people who have family members who have heart disease, people who just want to increase their knowledge base about what the future of cardiovascular disease management holds, it's really open to everyone, and anyone would benefit from coming to SIF community event who's curious about the newest managements in heart disease.
Another tip to help achieve heart health is to practice good dental hygiene, especially flossing. Gum disease can put you at risk for heart disease. Also, make sure you're getting enough sleep. Studies show a lack of sleep could put you at greater risk for a heart attack and stroke. Here's what's coming up next on the show. Getting the perfect smile with the help of new technology. And a center that has a unique approach to help people struggling with addiction. Getting a new smile is attainable at Permadontics. Their state-of-the-art services are giving patients their smiles back.
And aesthetically, how do you like the way it looks?
Yeah, I am very pleased.
Permadontics is a specialty clinic that focuses on implants that are immediately loaded, meaning putting a tooth on, a temporary tooth on right away. Dr. Ayers and myself were one of the pioneers in the development of this technique. You see the patients for the first time, they're fearful, they're unsure of what you're telling them actually is the truth. At the end of the day, when we see them with their new smile, it's like a different patient.
You smile at people and they smile right back at you.
It felt great when I first saw myself. It looked really nice.
My other teeth looked okay, but these look terrific.
I was going to a new job, so no one knew my old teeth. So I just smiled all the time and everybody told me I had beautiful teeth. And I said, thank you.
To have a good set of teeth is extremely important, not only just for your appearance, but to be able to function correctly and eat properly and just feel more confident in yourself.
We offer everything that's involved with dental implants. We're the only implant center in Southern California that has its own porcelain lab and only does finals in porcelain.
They gave me a tour of the person that does the final teeth, and it's quite an involved process.
He created such great teeth that nobody knows I even have them.
And my mother said they looked exactly like my baby teeth. That's how correct that they got.
They are first class with what they do, for sure.
Okay. I had crowns on all my teeth for 45 years. So they always had to be redone. And pretty soon there just wasn't anything to redo. And so my dentist suggested a few implants. But I knew I probably needed more than that.
Most of our patients are fed up, meaning they've had a lot of dentistry and they want a permanent solution where they're not going to be stuck in this cycle of constantly going back to the dentist for more and more work.
It's so nice not to be going to the dentist anymore.
Having everything in one roof makes it a lot easier for treatment planning. And then having hygiene here makes it easier for the patient to come for hygiene checks. I've been doing this now for almost 45 years, and that's what keeps me going, is the interaction with the patients and seeing these life-changing stories.
Getting this done makes me smile more.
I feel great, so grateful that I did this. I couldn't even imagine not having these teeth.
I feel sometimes exuberant, if that's too much of a word.
Don't go away, we have more to come on Your Health. A story of struggle and addiction and how one woman came out on the other side. Getting on a path to recovery was a struggle for Izzy, but with the help of Decision Point, she's now on her way to success.
Where I grew up was like, if you can keep doing the stuff you need to do and you can still manage to get messed up, then like it's fine. That lifestyle stayed with me. It was, if I had a good day, I wanted to get drunk. If I had a bad day, I wanted to get drunk. I lived with my good friends at the time, and I guess they got to see me behind closed doors. I kind of tried to play it off like I'm fine, everything's fine. Like, I didn't want my problems to be like a burden on them or kind of seem like I was like throwing a pity party for myself. They got to see me become like an isolation drinker and disappear kind of inside. Like, people talk about how when they go to treatment, they're like in a shell of themselves, and like that's what it was. They've been talking with Decision Point, and they gave me an intervention, and they said, we can't help you, and like we know you can't help yourself, but like we're taking you to some place that can, and it did. Decision Point has done so much for me. I don't even know where to begin. Their group therapy is awesome. Like, I had never been in that type of a setting before. They wanted me to talk about my problems, and like I've never really had that. My feelings and hardships, they were important, and they made me okay with myself in ways that I had never been even before I started using drugs. I've had friends that were girls my entire life, but it's never reached the level of depth that it did when I was there. A&R was awesome, activities and recreation. They do a really good camping trip. It's a lot of fun. We also did, recovery-oriented exercises. Like, we had time to kind of meditate in the forest alone. It was just nice to be out of a treatment setting and being able to enjoy myself and knowing oh, this is actually gonna be possible. They set me up for living a life outside of treatment. I still live in Prescott. I go to meetings in my home group. I work at a restaurant here, and I also house manage. I fellowship, and I just surround myself with sober people. It's crazy that I can wake up and know that I'm capable of living a day, going to work, getting errands done, doing things that I never used to be able to do without either being on something to give me the energy to get through it or drinking something afterwards to reward me. That's something that I never thought that I would have for myself. Thanks to Decision Point, I've been sober for 16 months.
We want to thank Kaleidoscope Juice for having us out today, and thank you for joining us on Your Health. I'm Erica Cardenas. See you next time.